Brittany Bruffy, and I'll be doing your head, ears, eyes, nose, and throat, and neck assessment. Can you tell me your name?
Lisa Bruffy.
Perfect. So what you want to do first is gather all your supplies. So I have a pair of gloves, an otoscope, and hand hygiene. So I'm going to do hand hygiene. You always want to provide patient privacy. So her general appearance, patient is sitting upright. She looks comfortable. Her clothes look clean and neat. She is dressed appropriate for the season. Her skin is nice and pink. There's no obvious signs of deformities. Her posture is good. Her affect is good. Her mood is calm and cooperative and happy. Her speech was clear, no slurring. And you can hear me okay?
Yes, ma'am.
So her hearing is good. She can hear me from where I'm at. Do you have any trouble swallowing, eating food, any weight loss?
No.
All right, so her diet is adequate. She's not anorexic. Her eye contact is good. You can see me from this far.
Yes, ma'am.
So that's perfect. Her level of consciousness appears to be good. Can you tell me where you're at right now?
Home.
Perfect. You know what year it is?
2020.
So she's awake, alert, oriented, so that's great. All right, I'm going to start with her head. So I'm going to kind of palpate here. No pain anywhere. There's no obvious signs of trauma. So I'm going to feel the frontal, the temporal, the occipital, and the parietal. All right, I'm going to feel her temporomandibular joint. Open your mouth and close. Perfect. And feel her temporal pulses. They're both good and strong, so that's perfect. So her hair, there's no obvious signs of hair loss. Her hair looks good. It's not brittle. Her face is symmetrical. There's no signs of drooping or any signs of trauma. I'm going to feel her sinuses. So we have the frontal and the maxillary. Any pain with that?
No.
Perfect. So I'm going to move on to your eyes. We're going to start with the confrontation test. So what I want you to do is cover one eye. All right, and I'm going to wave my fingers and you're going to tell me when you can see them, okay?
Okay. 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 Okay.
Perfect. Now cover the other eye.
Okay. 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 Okay.
Perfect. So that's awesome. You can do the corneal light reflex where you shine a light on their eye and the cornea will usually shine back. So that's that. And then you can also do the red reflex test with an ophthalmoscope. You would take the ophthalmoscope, stand back at a distance in a dark room, and you would shine the light and you would see a red reflex and you would follow that all the way in. All right, I'm going to do the 6 cardinal positions of gaze. So I want you to look at my nose and without moving your head, follow my finger. Perfect. So that's good. All right, I want you to, this is the cover test. I want you to cover one eye. And I'm going to watch for deviation. Just focus on my nose. All right, and uncover that one and cover the other one. So that's perfect. So there was no deviation. If the other uncovered eye was to move, that would be a sign of strabismus. All right, so I'm going to look at her eyes. The eyelids are good. There's no obvious signs of trauma. The eyebrows are good hair. The conjunctiva, It's good. There's no obvious signs of trauma. The sclera is the white part of her eye. It's not excessively red. Do your eyes hurt at all?
No.
Alright. The cornea, there's no obvious signs of tears. And the iris is the blue part of her eye. Her eyes are blue. Her pupil size is about 3 to 4 millimeters. So I'm going to check for perla. So her pupils are equal, round, and reactive to light. If you could look at my nose and then look back at the wall and then back at my nose. So her eyes do accommodate. So perla is present. We can also use a Snellen chart to check her eyes, which is the chart with the big E. I would ask the patient to cover one eye and read the smallest line of letters that they could legibly read. And that's another way you could check their vision. So I'm going to move on to her ears. So there's no obvious signs of drainage or trauma or deformity on either side. Both sides look good. So now I'm going to inspect the ear canal with my otoscope. For adults, you want to pull their ear up and back. So her tympanic membrane looks good. It's pearly. And that side looks good too. I'm going to do the whisper test, so I'm going to cover one of your ears and you tell me what word I say.
Banana. Basketball.
So that's good, so she can do that perfectly. So now I'm going to check her nose. Her nose is symmetric in her face. It's not to one side or the other, it's perfectly midline. I want you to cover one side and try to breathe and then do the other side. So her nose is patent, so that's good. I'm going to look inside her nose. So her nose looks good. The turbinates that I can see look good. There's no deviated septum. Nasal mucosa looks good. All right, I'm going to move on to her mouth. So I'm going to put on my gloves for this part. All right, I'm going to look at the buccal mucosa and open her mouth for me. Looking at her gums, her teeth. So her buccal mucosa looks good. It's nice and pink. Her teeth look good. There's no obvious signs of broken teeth, so good dentition. The floor of her mouth looks good. I did not see any sores or lesions. Her gums look good. There's no excessive swelling, no excessive redness. Her hard and soft palates, I'm going to use my light to look inside her mouth. So I'm looking at her soft and hard palates. They look good. I'm going to check her uvula. So her uvula looks good. It's not swollen. It's not red. Her tonsils are a grade 0. You can tell that she had her tonsils removed. All right. You stick your tongue out and say ah again.
Ah.
All right, that's good. And then just stick your tongue out. Okay. All right, I'm going to move on to her neck. Any tenderness or pain in your neck?
No.
There's no jugular distension, which is good. So I'm going to palpate all your lymph nodes. So we have the preauricle, the parotid, the submandibular, the tonsillar, post-auricle, the occipital, the superficial cervical. Can you turn your head for me? Sometimes you can feel the deep cervical, but I can't feel hers. The posterior cervical. And the supraclavicular. Those all feel good. Any pain with those?
No.
Okay, perfect. Alright, I'm going to feel her carotid pulse. Pulse feels good on both sides. Alright, I'm going to feel her trachea. I'm going to displace it and it goes right back to midline. So that's perfect. I'm going to feel her thyroid. You swallow. That kind of brings the thyroid up to the front. Any pain with any of that?
No.
Perfect. Everything feels good. Now can you move your neck up, down, side to side? So good muscle movement. And she's able to hold her head up and not tilting to one side or the other, so her strength is good. She's got good strength, good range of motion. And that concludes our assessment. Do you have any questions?
Nope.
Okay, perfect.